Assalamu alaikum and welcome to the new lecture on drug study design. The material for this chapter has been taken and adapted from the textbook of Remington, The Science and Practice of Pharmacy. I am Shoaib Mohammed, lecturer in the Department of Pharmaceutics, Faculty of Pharmacy, University of Sindh. This is the outline of the lecture. In this lecture, we will be discussing the purpose of study design, the types of medical researches. Then we will be discussing different types of the medical researches that include the descriptive studies, explanatory studies, observational studies, and the experimental studies. The clinical drug literature involves various research studies, and the study design of the research studies is a very important component. It is very much necessary that first we decide that what will be the design of the study, that how we will carry out the study. It is a very much important, because without determination that how we will carry out the study, we cannot reach to the proper results and the conclusions. Secondly, the study design always have a question, or a research study always has a question, like whether a specific drug is producing a specific adverse effect or not, or a drug is producing a specific therapeutic effect or not. A drug at a specific dose will produce the therapeutic effect or not. The drug at a specific dose will produce the adverse effect or not. So all the research studies contains a question, and after that after the conduction of the study, we will have an answer of that question, that whether this is happening or not. And to reach that answer, we must decide or design the study in a proper manner. Without the proper designing or determination of the study, we cannot reach to the conclusions, or we cannot draw the inferences, or we cannot draw the results. And based upon the different type of the studies, the different statistical tools will be applied. There are different type of the studies, and on the different type of study there are different statistical tools, or we say different statistical tests which are applied. And by application of these statistical tools, or the procedures, or the we say the tools, we can obtain proper results, and from where there we will obtain the proper conclusions. So based on the study design, the medical research studies have been broadly categorized into the two groups. Number one are the descriptive studies, and number two are the explanatory studies. In the descriptive studies, there are further two subdivisions. One is called as the case reports, and other is called as the case series. The explanatory study has been further divided into two major categories. Number one is the observational, and second is the experimental. The observational study is further divided into the case control, cohort, and the cross-sectional studies. Now we will go into the details of these study designs. So number one is the descriptive study. In the descriptive study, we are describing a situation or an interesting and unique phenomena. Okay, this is something new is happening. Okay, which may not have been reported before. Okay, and first time this has been reported, so this will be called as a descriptive study. In other studies, you might see that there will be a comparison, that this adverse effect was occurring in this patient, this adverse effect was not occurring in other patient. Okay, or we will have two different patient groups, and we will be observing the effects of the drugs on the two different groups. While in the descriptive studies, there is no any comparison. Okay, the phenomena is new, or the phenomena is occurring at the first time. For example, we are carrying out the treatment of a patient and we observe that during the treatment of the patient, a sudden adverse reaction is occurring which have been not been observed before. So we will report it, and this will be called as a descriptive study. The descriptive study has been further divided into the case reports and the case series. In the case reports, we are giving observations from an individual patient. We are observing an individual patient and any changes occurring into that patient, any adverse effect appearing into that patient, any new and unusual adverse effect or drug interaction occurring into that patient, we are observing that and we are reporting that. Now this new adverse effect or new interaction or new phenomenon may be due to a single drug or maybe due to groups of the drugs. Maybe a combination of therapy was given and because of that combination of therapy and a new adverse effect appeared. So we will report that because of the use of this combination of drug, maybe we in certain situations we might not be sure, so we will say that maybe because of the use of this combination of drug, the adverse effect has appeared, and then we will report that adverse effect or the drug interaction. In the case series, we are observing a series of patients or a group of patients from a same category. Okay, maybe the patients of hypertension, we have used a new drug. Okay, or we have even used a drug which has been commonly used, but because of the use of that drug, a new adverse effect has been appeared which has not been reported before. So we will report that adverse drug reaction or a drug interaction, or there may be combination of the drugs that were used for the group of the patients, and because of the use of that combination of drugs, a new adverse drug reaction, a new toxicity, a new drug interaction was found that was never reported before. So we will observe that effect, we will identify the intensity of that effect, we will record that effect, and we will report that effect into a research study, that while we were doing such type of the treatment on such type of the patients, such adverse effect or drug interaction or toxicity or certain change into the physiology, certain change into the medical reports or the diagnostic reports or investigative reports was observed. So in the case reports, we are reporting a new phenomenon on a single patient, on an individual patient, while into the case series we are reporting adverse drug reaction or interaction or a new phenomenon on a group of patients. Now the advantages and disadvantages of the descriptive studies. The descriptive study has advantage that it is very easy to conduct. Okay, you are observing an effect and you are reporting it simply, and it is also inexpensive. You don't have to hire people or perform certain tests onto the number of patients, and that will be very expensive. So it is relatively easy and no any expenses are incurred onto the researcher. Second advantage is that these provide the preliminary information. Okay, one physician will be reporting that this adverse effect was appearing, and other then other physician will also be reporting that this adverse effect was found on some of the patients. So they will be collected together and a new study will be designed, okay, which will give rise to the new questions that whether it is really happening or not. So this will be the basis that the further researches onto the drugs or the diseases can be carried out. The disadvantage of the descriptive study is that the patient might not be representative of the others or a specific condition. Now the specific adverse effect that was appearing on that patient might be because of the certain change into that patient. Okay, certain changes into the physiology of the patient that may not be specifically because of the drug, but certain changes into the patient. Now that is patient to patient variation. So we have to identify that whether the phenomenon was actually occurring because of the drug or the phenomenon was actually occurring because of the patient. So there may be patient variation and there may be reporting differences because two different patients might not have the same physiology. So the effect of the drug will be different on one patient and the other patient. And information provided is subject to many potential biases. Okay, there may be that the physician has not clearly understood the reaction, or the other medical practitioner has not clearly understood the adverse drug reaction, or there was not proper reporting. Okay, the communication was not proper, so a simple situation was exaggerated and reported into the literature. The explanatory studies are more rigorous or more detailed studies, and they more clearly answer a question. We are studying a drug and we want to make sure whether certain outcomes are because of this drug, whether this therapeutic effect is actually because of that drug, or the adverse effect is actually because of that drug, or a drug interaction is actually because of that drug. So it is a rigorous study, and the investigators are designing the study in such a way that a clear relationship is found in between an outcome and the drug. The explanatory studies are further divided into observational and the experimental studies. Though there are many differences in between the observational and the experimental studies, the major differences are elaborated here. Firstly, the observational studies may be prospective or retrospective. In the prospective studies, we are observing the effect on current basis, means treatment onto the patient is going on, and we are looking into the treatment of the patient. The patient is coming onto the regular basis to the physician, or the patient is coming onto the weekly basis to the physician, or coming to the monthly basis to the physician, or even the patient may be an inpatient and we are observing the patient in a single day for multiple of times. Okay, and we are observing the changes into the prescription, we are observing the changes into the treatment. Okay, we are observing whether the drug is producing the therapeutic effect or not. Okay, so we are also observing the patient during the treatment, and we are also will be looking into the patient's follow-ups, okay, into the future of the patients, that whether the treatment will be effective or not. The observational studies can also be retrospective. Okay, we will look into backward into the data. Now for example, a patient came to a hospital, he stayed at the hospital for some period of time, a specific treatment was carried on onto the patient, and after the therapeutic effects were achieved, the patient was discharged from the hospital. Now the patient record will be into the record room. So various patients records will be present into the record room. Okay, now we want to observe the effect of a specific drug, like the specific drug, how the specific drug was effective into the hypertensive patients. So we will take all the records from the record room and find out the patients who were hypertensive and using that specific drug, and then we will observe that what kind of changes were taking place into those patients. So this we call it the retrospective study. In the prospective, we are observing the current effect and the effect of the drug into the future. While into the retrospective, we will be observing the treatments or the effects of the drug in which the patient has been discharged or the treatment has been completed. However, into the experimental studies, these are always prospective. Okay, the experimental studies cannot be prospective. Experimental studies are also always prospective. And while the experimental studies, we are observing the patient during the treatment and even after the treatment, and the investigators may be changing certain things or changing certain parameters of the treatment. Okay, maybe changing the doses of the drug to observe the effect of the drug, or they will increase the dose of the drug or decrease the dose of the drug to make sure that whether the therapeutic effects are achieved or the adverse effects are decreased. So during the experimental studies, the investigators, the person who is conducting the research, may make changes into the therapy. Okay, into the observational studies, we are only observing that what is going on. However, into the experimental studies, we are observing, but we are also making certain changes into the therapy. So this is will be called as the experimental study. Now if we go into the details of the observational studies, in the observational studies, the investigators are just acting as the bystanders or the witnesses. Okay, a treatment is carried out, and the investigator is observing that the treatment was effective or not, that the therapeutic effects were achieved or not, whether any toxicity was occurring or not, whether any drug interaction was occurring or not. So the investigator is just observing the treatment and how the things are going on during the treatment. After the patient is discharged, he will take the follow-up and observe all the events, that the whether the patient has came to its normal routine life or not, and the therapeutic goals have been achieved or not. Okay, then after observing these effects on the multiple of the patients, the investigator will classify the data. Okay, he may put the data into different genders. He may classify the data on the base of the age. He may classify the data onto the base whether the where the person is living, whether he or she is living into the rural area or the urban area, and then he will compare. Okay, he may also classify whether the patients who were taking the higher dose, the patients who were taking the lower dose. Okay, and finally he will make comparisons, that whether the therapeutic effects were more observed into the males or the females, the therapeutic effects were more observed or better observed into the young patients or the old patients, whether the adverse effects were occurring more into the young patients or the older patients. So these different comparisons will be made based on to the observations, and based on the observation, then the conclusions can be made that the drug was whether more effective into the young population or into the old population, or whether it was effective into the male or whether it was effective into the female. So in these studies, we take hundreds of the patients or thousands of the patients, and then we will give observation based on our we say whatever we were going through during the studies. Now, to evaluate that whether a specific drug has produced a specific outcome, different approaches can be made to confirm the link between the drug and the outcome, or the outcome and the drug. So mainly there are two approaches. Number one is the case control studies, in which we are observing effect or outcome, and we are going back to the cause. Okay, now for example, we might have multiple of the patient records, and we will observe that this specific outcome of the drug effect was occurring in this patient, and then we will go into the records of those patients, that what might be common thing in those patients, And if we find a common thing that was being used or was happening with these patients, so we will then link that this might be the cause of this effect. This might be this drug might be the cause of this adverse effect. Okay, in the cohort studies, we are going from the cause or exposure to the effect. We will observe the drug, we are giving a drug, and we are observing, okay, certain case series or the case reported has shown that this adverse effect was some specific adverse effect was occurring in a patient. So to confirm that, we will observe a group of the patients, okay, that may be in hundreds or thousands, who are taking that specific drug, and we will continuously observe those patients. And after observation and completion of the treatment and after the follow-up, if we see that those patients were suffering from a specific adverse effect or certain thing was appearing or certain phenomenon was happening into this patient, so we will link the that this drug was actually causing this adverse effect, or this diagnostic test was causing this problem, or this we say the device or equipment was causing these problems. However, into the cross-sectional studies, they are also part of the observational studies. We collect data simultaneously from the comparison groups. Okay, we make two groups. Okay, one who has been given the drug, other who has not been given the drug, and then we compare that what effects were occurring into these different groups. If we go into the details of the case control studies, in case control studies we have two groups of the patients, and in those two groups of the patients we are observing a disease state or a condition. The one group is having the disease or the condition, and the other group is not having the disease or the condition. And then we evaluate the current habits or characteristics of the patients and the past characteristics or habits of the patients, and we observe that whether to which of the substances these were exposed into the past, and then we reach onto the conclusions that these might be the certain factors which might be involved into this disease or a pathologic condition. Now here is an example of the case control study. Now for example, there was a study carried out to evaluate that the cancer chemotherapy causes leukemia into the breast cancer patients. Okay, it was observed that when the breast cancer patients were going for the chemotherapy, leukemia was also observed into those patients. Now, to confirm that, what was the risk factor due to that was causing the leukemia? So, patients of the files of the 90 women from the past were taken. That was in time period of 1973 to 85. Okay, and all these files were observed, and it was observed that these women had leukemia. Okay, then two additional patients with the breast cancer without leukemia, their files were compared with them. Okay, there were certain number of files or the patient records which were having leukemia after the chemotherapy of the breast cancer, while there was another group of the patients who was also having the breast cancer but was without leukemia. Now, when their files were observed in detail, it was found that the patients who had leukemia were having are going through the regional radiation, or there is also the patients of the cancer are also going through the radiotherapy. So those patients who are going through the regional radiation therapy, they were having the leukemia, and those who were not having are going through the regional radiation therapy, they were not having the leukemia. So the case control studies are also retrospective because we have to go into the past of the patient to confirm that what were the factors to which the patient was exposed, and that resulted into some kind of the pathological situation or a disease. There are always control groups to compare that which of the group was exposed to which material or was having which kind of the characteristics that led to that pathological condition. So we will have two different groups, and one group was exposed to certain situation and other group was not exposed to the certain other situation. And into the case control studies, we always know the outcome. Like in the example, as we said, the patients of the breast cancer who were going through the chemotherapy were having leukemia. Okay, so we knew that the patients were having leukemia. Okay, patients were suffering from leukemia, so we have to we knew the outcome, but we were determining that which was the factor which was causing the leukemia. So eventually it was found that it was the regional radiotherapy that was influencing the leukemia. And next is the into the case control studies, we are measuring the risk. So as into the example we discussed, so the regional leukemia was one of a risk during the breast cancer chemotherapy, and this was causing the uh, disease or pathological condition into the patients. The case control studies are sometimes also called as the TROHC studies. The cohort studies are basically longitudinal and observational in nature. In cohort studies, we are observing the patients for longer period of time into the future. The patient has received certain treatment, and we are observing the patients maybe for 1 year, 2 year, 5 years, 10 years, or 15 years, and we observe that whether any kind of the adverse effect, any kind of the drug interaction, any kind of the pathology into the future has occurred onto the in the future. The cohort is basically the group of patients which has not experienced any kind of outcome. Okay, but still we are observing that the patient has taken a drug, though at current time it has not faced any outcome, but we will continuously observe the patient that whether any kind of the effect is produced into the future or not. So there is the observation is on to the patient is for a longer period of time, and then observation are recorded and reported. The cohort studies can also be prospective or the retrospective. Into the prospective, the treatment is being currently going on to the patients, and we will observe the patients into the future, okay, after 1 year, 2 year, or 5 years. Into the retrospective cohort studies, we will take the records of the patients which were continuously coming to a health facility. All of the patients' records will be taken, and we will observe that whether any of the effects were occurring onto these patients or not. So here is an example of the cohort study. Now, for example, in order to calculate the relationship between high serum cholesterol concentration and the risk of development of heart disease, about 1,000 healthy men within the age group of 30 to 35 years were enrolled into a study. Okay, as we said, these studies are carried on a larger group of the patients. Larger the group, more authentic will be the results. Now then, these 1,000 healthy person within the age group of 30 to 50 years were divided into two groups. uh, those who were having cholesterol level less than 180, and others which were having the cholesterol level more than 180, and then they were giving medical checkups onto the regular basis and onto the yearly basis. At the end of the 10 years, the results were recorded, and it was observed that men with the high cholesterol were 2 times more likely to the development of the heart disease. When all these patients were going through the medical checkups for about 10 years into the research study, it was observed that those who were having cholesterol level of more than 180, they were having more chances of producing the heart diseases. So in this we made two different groups, okay, and we made a parameter that those who are having the less cholesterol and those who are having the more cholesterol, and based on that we determined that those who were having more cholesterol levels were having the higher chances of the heart diseases. The cross-sectional studies are also known as the prevalence studies or the survey studies. In the cross-sectional studies, we observe that some kind of the condition is occurring into a specific population or not, and which are the factors which are causing these conditions. So this is basically leads to the chicken and egg phenomena, that whether the chicken came first or the egg came first. In certain situations, the adverse effect might be due to some risk factor, or a risk factor will be causing a adverse effect, or even into the certain situation, the risk factor will be manifestation of a specific disease. The specific disease for which the drug is given will be producing a condition, a risk factor, and because of that risk factor, the drug will be producing an adverse effect. So here are two examples of the cross-sectional study. Into the first example, a group of patients who were having the adverse drug reaction due to the glaucoma patients, okay, they were identified to determine the risk factor which was causing the adverse effect. Now these patients may be given different questionnaires, different questions will be asked from these patients, and based on these questions we will determine that which of the risk factor was causing the adverse drug reaction into these patients. The other example is about the effect of the age onto the serum creatinine, or whether the serum creatinine increases with the age. So simply, the patients, about 40 healthy subjects, not the patient but actually 40 healthy subjects were taken between the age of 18 to 70 years, and their serum creatinine levels were determined, and it was observed that the serum creatinine level of the subjects with younger age have the less serum creatinine level, while the patients with the more age or the elderly patients had more serum creatinine level. So in which, in this the cross sectional studies, we are observing the effect, and we are observing that whether that effect is due to certain risk factors or not, and if there are any certain risk factors, that will be communicated to the research in the research studies, and that will be beneficial for the patients into the future. Now about the experimental studies. So as earlier discussed, the experimental studies are always prospective, means they are applied onto the current treatments. We observe the effects when the treatment are going on, or when the phenomena is happening. So at this time the study is being carried out, and most of the experimental studies are carried out during the clinical trials to observe the effects of the new drugs. And another important factor into the experimental studies is the intervention. Okay, we are the investigator deliberately changes certain factors, might increase the dose of the drug, might decrease the dose of the drugs, or might change the route of administration to observe that the specific outcomes are being achieved or not. And they also regulate certain other variables. Okay, that the patient is living in a specific environment, the patient is taking the specific diet, so we observe that whether with this diet the therapeutic effects of the drug was observed or not, or with the other diet whether the therapeutic effects were observed or not. The experimental studies are further divided into the two groups, or the two types, called as the controlled and the non-controlled experimental studies. In the controlled experimental studies, we might have two different groups. Okay, to the one group we are giving the drug at certain variables, at certain parameters, and to the other groups we have not controlled the parameters and we are giving the drug. Or in one group we are using the specific drug, while into the other group the placebo treatment is being carried on, or they are being treated with the with some older drug, okay, which was used previously, and we are comparing whether the new drug is more effective or the older one is more effective. However, into the non-controlled studies, we don't have any comparative groups, and we are using the drug on a specific group of patients with controlled variables, and we are making changes into the treatment, and we are observing that our new drug is producing any kind of the effects or not. So here we have the hierarchy of the research design. That means which of these experimental methods or the study designs have more authenticity. So the descriptive, cross-sectional and the case control studies, these provide the lowest level of evidences, because in that there may be certain external factors which might have influenced on to the study, and the evidences will not be proven, the evidences cannot be confirmed. So these have the lower level of the evidence. However, the cohort studies, though it's a we say the descriptive study, and it is done in such a way, or it is designed in such a way that the evidence is of very higher level, as well as the experimental or the randomized control studies, they also have higher level of studies. So these two, the cohort and the experimental, these are more authentic, while the descriptive, cross-sectional and the case control have the lower level of the evidence, are less authentic. This is all about the drug study design. Thank you very much for your time.